Congresswoman Pramila Jayapal introduced Lift the Bar Act on June 24 to restore access to federal healthcare, nutrition, and other public benefits for lawfully present immigrants. The legislation is co-led by Rob Mendes and aims to remove long-standing eligibility barriers affecting immigrants with legal status. The bill would restore access to key federal programs including Medicaid, the Children's Health Program, SNAP, temporary assistance for needy families, and supplemental security income. If passed, the legislation would eliminate the 5-year waiting period that prevents many lawfully permanent residents, DACA recipients, and other legally present immigrants from receiving federal benefits. The proposal would also reverse immigrant eligibility restrictions introduced under Republicans' One Big Beautiful Bill, which limited access to Medicaid, SNAP, and other benefits for several categories of legally present immigrants. Jayapal argued that immigrants are unfairly blamed for cuts to public programs, saying Republican lawmakers, not immigrants, are responsible for reducing healthcare and nutrition assistance. She said the legislation would end what she described as arbitrary and xenophobic barriers that prevent lawfully present immigrants from accessing programs they help fund through their tax contributions. Mendes said immigrant families are essential to American communities, the workforce, and the economy, and should not be excluded from benefits supported by their own tax payments. He described the bill as an effort to reverse anti-immigrant policies enacted under the Trump administration and remove barriers preventing immigrants from supporting their families and achieving economic stability. According to the bill sponsors, Republican One Big Beautiful Bill reduced federal healthcare spending by nearly $1 trillion and cut approximately $200 billion from nutritional assistance programs. The lawmakers said those spending cuts were accompanied by new restrictions on Medicaid and SNAP eligibility for several categories of lawfully present immigrants. They also noted that many of the current restrictions stem from 1996 federal law that imposed a 5-year waiting period before many legal immigrants could qualify for federal assistance. The sponsors estimated that existing policies have left many lawfully present immigrants without healthcare and nutrition benefits, including roughly 105,000 children. Beyond restoring eligibility, the Lift the Bar Act would calculate benefits based on the income actually available to sponsored immigrants, limit states from imposing additional restrictions, and allow states greater flexibility to provide benefits using their own funds. The legislation has received support from immigrant advocacy groups, including the Center for Law and Social Policy, the National Immigration Law Center, and the Protecting Immigrant Families Coalition, and has attracted nearly 100 Democratic co-sponsors in the House.